Muhammad, I think question regarding phenylketonuria might be part of our test today. Do you know what is phenylketonuria? PKU, a rare inherited disorder that causes an amino acid called phenylalanine to build up in the body. PKU is caused by a change in the phenylalanine hydroxylase gene. This gene helps create the enzyme to break down phenylalanine. Do you understand why I'm explaining?
Maybe I will go through the concept slowly.
Alright. Wait a moment. I want to go to the washroom first.
Can you hear me, Muhammad?
Who are you?
Hi, I'm Hayden. We are your small little brain cells who are going to help you to score your biochemistry test. So today, I'm going to explain to you about the biochemical pathway, specific gene, and also the symptoms of PKU. In terms of biochemical pathway of PKU, the first thing we need to know is both phenylalanine and tyrosine are important amino acids in humans' body, but it cannot be produced biosynthetically, which is why humans should consume food such as milk, cheese, chicken, yogurts, and etc. that has those amino acid nutrients. The biochemical pathway of PKU is the conversion of phenylalanine to tyrosine. The process is catalyzed by an enzyme called phenylalanine hydroxylase and cofactor tetrahydrobiopterin. Phenylalanine hydroxylase are produced in humans' liver and kidney. The tetrahydrobiopterin is essential to be present during the process, which is why the NADH is used to donate the electrons to dihydrobiopterin to develop a tetrahydrobiopterin again. Cofactor is recycled by using an enzyme called dihydrobiopterin reductase to reduce the dihydrobiopterin to tetrahydrobiopterin. PKU can occur due to low in phenylalanine hydroxylase that causes the incapability of the phenylalanine to convert into tyrosine. Next, the specific gene that causes PKU is phenylalanine hydroxylase, known as PAH. The gene is located at chromosome 12q24.1. The occurrence of aberrant splicing mutation causes PKU due to the skip from exon 11 to exon 13, causing the mutation present in the coding areas. PKU is an autosomal recessive inheritance illness, which implies that the genetic chromosome is inherited by offspring from their parents. Next, signs and symptoms of PKU. Newborn may look normal at birth, but without proper treatment, they will start to show signs such as nausea and trouble eating. As for infants and young children, they will have development delays and also learning problems. They will also have a strange body odor due to the phenylacetic acid in their sweats and urine. As for adolescents and adults, they will be having a neurological symptoms such as seizures and tremors, which would affect their mental health and cause them to fall into depression. Here's your ticket to the next station.
Oh, how curious. Thank you.
Hi Muhammad, I'm Katunaria. Fanny must send you here, right?
Yeah.
Okay, so I'm very excited about our journey today because I will explain to you about method of diagnosis and the treatment of the PKU.
Hello, okay, so we go to the PKU diagnosing, which is the method to examine and check amino acid disorder. There are three methods that we can learn in the PKU diagnosis, which is the first one is ferric urine test and its limitation, Hill prick test and how it appears, and the confirmational test plasma amino acid test. Okay, the first method is ferric chloride urine test. Before the putrid test, doctor used the less reliable ferric chloride urine test to detect PKU. These tests identify phenylpyruvate in urine by mixing the sample with water, ethanol, and ferric chloride. Turning blue green is positive, however, if often means low phenylalanine level. Failing to diagnose many often in the first 6 to 8 weeks. As a result, undiagnosed infant develop severe symptoms and irreversible brain damage. For the second method is Hill prick test, which is in 1957, Robert Putrid developed the Hill prick test for PKU. Replacing the less reliable ferric chloride test, Putrid method used a gel that inhibited battery cloth unless phenylalanine was present indicating the PKU. Blood from a Hill prick was placed on the gel, allowing quick and accurate screening of up to 200 samples a day. Putri test was more accurate and easier to use, leading to earlier detection and prevention of neurological damage. These tests become widely adopted and revolutionized PKU diagnosis. Okay, the last method is plasma amino acid test, which is the confirmation test. The plasma amino acid test screen infant for amino acid levels in the blood using a sample from a vein. High phenylalanine level indicate PKU. Normal levels are 41 to 68 micromoles per liter in adult and 26 to 86 micromole per liter in children. PKU patient managed level between 120 to 360 micromole per liter. Modern testing use LC-MS per MS for accuracy, but dried blood spot TBS testing is preferred for convenience. Standardized methods are needed for consistent results. That's all 3 methods that used in the PKU amino acid disorder. Okay, next we go to the treat or alleviate the effect of PKU, which is the phenylketonuria from amino acid disorder. There are 4 treatments of PKU amino acid disorder. Firstly is thyroid treatment. Second is large natural amino acid supplementation. Thirdly is enzyme therapy. And the last one is gene therapy. Okay, the first treatment is thyroid treatment, which is the PKU disorder need to avoid that food that have high in phenylalanine. For example, meat and cheese, egg, nut, soybean, chicken, and also the sweetener, which is found in drink, medication or vitamin. The treatment also can be monitoring and management, which is regular assessment of blood phenylalanine level and guide for adjusting the treatment. Okay, the PKU disorder person need to find the food that have the glycomacropeptide GMP, which is the naturally occurring protein low in phenylalanine, which is derived from cheese whey. The benefit of GMP is enhance the convenience, variety and taste of food and improve the dietary compliance and metabolic control, and also enhance the phenylalanine utilization and protein retention. Okay, the second treatment is large natural amino acid supplement. The role of large natural amino acid supplement is to compete with phenylalanine for transport across the gastrointestinal and blood-brain barrier. A two study showed that LNAA supplement significantly reduced the blood phenylalanine level in PKU patients. It improved the cognitive performance. And then the factor of effective delivery is supplement content, doses of 215 to 1000 mg kg per day, and the mode of administration. The benefit of large natural amino acid supplement is to increase the brain concentration of natural amino acid, to improve the cognitive outcome of PKU patient, and to fortify it with vitamin and nutrient, which is important for brain development. The third treatment is enzyme therapy. What is enzyme therapy? Enzyme therapy is an injection of enzyme that metabolize the phenylalanines and change the metabolic phenotype of PKU regardless of genotype and reduce the elevated phenylalanine level. There are 2 methods that used in enzyme therapy, which is the first one is use phenylalanine hydrolyzase, and the second one is enzyme substitution, which is use phenylalanine ammonialyze. The enzyme substitution is more accurate because it can convert excess phenylalanine into the ammonia and tranexamic acid. The benefit of enzyme therapy is to compensate for inadequate phenylalanine hydrolyzase and lower the dangers of phenylalanine level in the body of the PKU patient. The last treatment is gene therapy. What is gene therapy? The gene therapy is to treat non-hepatic tissue like muscle efficiently, which is to introduce genes for tetrahydrobiopterin and phenylalanine hydrolase, which is muscle cell can convert phenylalanine to tyrosis. Advanced in viral vector have led to trial for other metabolic disorder. About 10% of PKU patients have a mutation causing a annually stop codon. Antibiotic like gentamicin can bypass the stop codon, allowing photosynthesis. Study in cell line showed this antibiotic restore some enzyme activity, helping manage the PKU amino acid disorder. That's all from the diagnosis method and the treatment that can be in PKU of amino acid disorder.
How am I? Okay, last question from me. How is your level understanding after meeting all the brain cells?
Okay, honestly speaking, now I understand about the PKU and I understand the concept of the phenylketonuria, and I understand its symptoms, its biochemical path, and its specific gene. And also I learned about the treatment of the phenylketonuria. Thanks to you.
Wow, I'm so glad that you understand about the phenylketonuria. Okay, I think our journey is end from here. Bye, Mama.
Let's go.
Okay,